What if the future of global health hinges on a single high-stakes meeting in 2025? On September 25th, 2025, world leaders will gather at the United Nations for the fourth high-level meeting, HLM4, to tackle one of the most pressing challenges of our time, non-communicable diseases, NCDs, and mental health. This landmark event will aim to craft a bold, actionable plan, a political declaration that could reshape how nations prevent, treat, and support people living with these conditions by 2030 and beyond. But here's where it gets controversial. Despite years of promises, progress is lagging. Are governments truly committed to change, or are they waiting for a crisis to force their hand? HLM4 is more than just another conference. It's a once-in-a-decade opportunity to align global efforts around NCDs and mental health, building on scientific evidence and human rights principles. The declaration to be adopted will serve as a roadmap, guiding countries to accelerate prevention, improve access to care, and address the root causes of health inequities. Yet halfway to the 2030 Sustainable Development Goals, SDGs, the world is far from meeting its targets. For example, SDG 3.4 aims to reduce premature deaths from NCDs by 1/3 through better prevention and treatment. But underfunding in healthcare systems has left millions without basic services, creating a dangerous gap in equity. And this is the part most people miss. The crisis isn't just about medicine. It's about poverty, pollution, unhealthy commercial practices, and systemic neglect. The stakes are immense. Without urgent action, entire communities will face long-term consequences, from economic strain to declining quality of life. The good news? Solutions exist. HLM4 urges nations to adopt a holistic approach, strengthening health systems, investing in sustainable funding models, and tackling the social and environmental factors that drive NCDs and mental health disparities. But here's the rub. These solutions require collaboration, not just between governments, but with businesses, civil society, and individuals. Will countries step up, or will political will remain as weak as the current progress? Ahead of HLM4, the World Health Organization, WHO, is calling for a united front. It's not enough for leaders to act alone. Civil society, including NGOs, UN agencies, and everyday citizens, must play a role. People living with NCDs or mental health conditions are not just beneficiaries. They're essential voices in shaping solutions. The question is, how can we ensure their perspectives aren't sidelined by bureaucracy or short-term thinking? And finally, a thought-provoking challenge for you. Do you believe this meeting can truly transform global health, or is it another empty promise? Share your thoughts. We'd love to hear if you agree, disagree, or see a different path forward.